didn't know who was going to be a secondary care consultant. We didn't know who was going to work in the emergency department or who was going to be a GP. But we all knew that we were in health to look after patients. Patients were at the centre of everything we were going to do. So I don't know where things went wrong, where suddenly we were being pitched against each other. Suddenly primary care was being pitched against secondary care. But when I think about it and I pause, I actually think that what happened was doctors became managers, or certain doctors became managers, and they actually betrayed the rest of us. And when you hear that doctors are in support of these reconfigurations, then rest assured that the majority of doctors actually aren't. They really aren't. The second observation is when I was a junior doctor, the porters used to have a band, and the porters' band would play, and the junior doctors and the nurses would all go to visit the porters playing their band. As a consultant, I now have to watch the porters striking because they're not getting minimum wage, because they're working for MediRest. As my beard gets greyer, am I going to see the community nurses in Virgin uniforms protesting in another corner of Ealing Hospital? Am I going to see the absence of my physiotherapists and speech and language therapists as everything just gradually becomes more and more fragmented? And what we used to have was a National Health Service which looked after the fundamental human right of health. And going back to law, the reconfigurations wherever they're happening in London are unlawful, simply because they are driven by the same thing that Louise was able to prove in Lewisham was unlawful. And that is, it's driven by finances, it's driven by PFI debt, it's driven by managers, including doctors who became managers, who betrayed the rest of us and set us up one against the other. So I think we really do have to explore the thing around the legal issues more than anything else, because the patterns are the same in all of the quadrants. The patterns are exactly the same, and if Lewisham could find the loophole, then we really need to look towards seeing how the similarities are exactly there. It's all about the PFI debts, it's all about the finances, it's nothing to do with the patients.